Okay, so I'm going to get started now. Can you hear me okay?
Yes.
So I'm going to be talking about the health benefits for the elderly of horse-human interactions. And this work was done jointly with Barbara Rector and Anne Alden. And it was done at an assisted living facility called Hacienda at the River in Tucson, Arizona. And this is a very special facility because I think I don't know if it's the only one, but one of very few that actually has horses brought on site so that the people can interact with the horses where they live. They don't actually have to go anywhere. So this happens 3 times a week. And when you think of assisted living facilities, I'm sure you think of all these people and they're all together and having a great time. Well, that's true for a lot of the people, but for some people, they kind of withdraw for various reasons, maybe depression. They withdraw, they don't take advantage of all the various activities they're offered, and they just kind of sit in their rooms. And those are the people that we're trying to help here. And with COVID, I mean, that made things even worse. So I saw this article in the New York Times, the new old age, just what older people didn't want, more isolation. So it can be a real problem. So you might think, okay, well, how can the horses help? Well, we think that the horses can help attract people to come outside. They have a reason to come outside. They have the horses, and we hope that they can become more engaged. That's our theory. So here we are, rationale. Social isolation. Why is social isolation bad? Well, when you withdraw from others and you don't show any interest in what's happening, it can lead to higher rates of depression and anxiety, increased risk of dementia and even premature death, and increased risk of heart disease and stroke. The heart is where emotions are stored. And your emotions can definitely affect your risk of heart failure. And in our previous study, which was actually it's going to be published soon, Mindful Grooming, the participants who were aged 55 and over, they all experienced changes in heart rate variability, which were beneficial, and enhanced social engagement. And I'm going to explain about heart rate variability and why that's important. So this is what I'm going to do, explain heart rate variability. I'll talk about our study at Hacienda at the River, protocol, some videos of experiences of the people, the challenges we had working with this population. So although our inclusion criterion was over the age of 55, many of these people were much older than that, most of them in their 70s and 80s and older. And so they did present some research challenges, which I'll mention. I'll talk about the results and then discussion. So heart rate variability is basically how the heart rate changes with time. And if you look at the bottom there, you can see an electrocardiogram in the red. And each spike represents a heartbeat. And you can see that in some places, the beats are close together, and in some places they're further apart. That is normal, that is healthy. That's not a heart that is not working properly, that's one that is working properly. The heart is not a metronome. So even as you're just sitting there, your heart is not going beat, 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 beat. It's changing minute by minute, even second by second, to accommodate your body's needs and your mind's needs. And that is healthy. So you can see when the beats are close together, the heart rate is going up. This is heart rate's going up. When the beats are further apart, the heart rate's going down. And it's the sympathetic part of the autonomic nervous system that increases heart rate, and the parasympathetic that brings it down. So they need to work together, they need to talk to each other, so you get this variation, which is healthy. And you can see this arrow here. This is the amplitude. How big is the variation? And the bigger it is, the healthier you are. The freer the heart is to adapt to your body's needs. So that's the amplitude of the heart rate variability. So I was talking about sympathetic and parasympathetic talking to each other, interacting with each other, so we get that variability. Sometimes you're in a situation where one overwhelms the other, like there's too much sympathetic activity and very little parasympathetic. So the heart is kind of stuck. It's not varying. It's not varying according to the body's needs. It's just stuck, regardless of what you need. And that's what happens when you're stressed. And that leads to low heart rate variability. So low heart rate variability, low amplitude, is a manifestation of stress. So that's why heart rate variability is a good marker to see if you're stressed or not. So here are some samples of heart rate variability of humans and horses. We can measure it in horses too by putting a sensor around the girth area. So the blue is human and the pink is horse. So if you look on the left, you can see the human heart rate variability going up and down in a kind of random way, which is totally normal. And then the horse, interestingly, we see this repeatedly. You can see this kind of pattern, this pulsing pattern going on with the horse at a very low frequency. We often see that, and that seems to be associated with horses who are at ease and just enjoying life. On the right, you can see the human one has taken on a particular pattern. That is called coherence. That's when you have the sympathetic and the parasympathetic talking to each other, making the heart rate go up and down in that rhythm. That's when you have good balance, and that leads to emotional regulation, good emotional regulation, and also good mental capabilities. So that is a good state to be in. So now we're looking at the pattern that the heart rate variability brings, as well as the amplitude. So we can see on the left in the blue a kind of random pattern, in the right we can see that rhythmic pattern. And so that's why frequency is important. So you can see that rhythmic pattern on the right there. There's a particular frequency with which the heart rate goes up and down. Not only that, but the heart rate variability doesn't just stay in the heart. Every time the heart beats, there's an electric current. If you have an electric current, that creates an electromagnetic field. And your heart is creating a field that can extend 10 to 15 feet from your body. So each of you, your heart is creating a field, and your field can interact with the person next to you, with their field. And we'll talk more about that, how the fields interact with each other. And this field pulses with the same rhythm as you're showing in your heart rate variability. And horses are very sensitive. They seem very sensitive to picking up on this vibration. So going back to the frequencies, scientifically we divide them into 3 ranges. Very low frequency, you can see the pink there, very low frequency, the blue, and the yellow is high frequency. So very low frequency is what we saw in the horses, very slow rhythm of heart rate changing. Low frequency is what we saw with the person who was in that nice balanced state. And then high frequency is like that. And they mean different things. So high frequency, if you have lots of the high frequency, it means you have lots of the rest of digest, lots of the parasympathetic going on. If you have lots of low frequency, you're in that very balanced state, sympathetic and parasympathetic talking to each other. If you have the very low frequency, like we saw in the horses, not so much is known about that, but it's thought to be an intrinsic rhythm of the heart that is representative of general health. And I'll show you some other work that has been done regarding the very low frequency. So why is very low frequency important? It's been shown that people who don't have very much of this very low frequency rhythm that we see in the horses, if they don't have very much of it, it can lead to PTSD, inflammation, and death from cardiac irregularities in the rhythm. So if you've got more of it, then it implies that you tend to have less of this happening. And our previous research shows that grooming horses shifts the people's heart rate variability to this very low frequency, which is a benefit. Oops. So, sorry about that. So our hypothesis in this study with the elderly, we propose that when older adults mindfully stroke horses, so they're not using a brush, they're stroking with their hands, they experience a sense of excitement without stress, along with an opportunity to socially engage with the horse. And both these responses are physically and emotionally beneficial to adults during their later years, so that they're kind of mild excitement together with the opportunity to interact. And this work has all been published. Recently it came out in Behavioral Sciences. So this Hacienda at the River facility was ideal for research. Number one, there was already an established equine program there called In the Presence of Horses that was started by Barbara Rector, and that is still going. The horses are still brought in 3 times a week for the people to interact with them. They're especially trained and screened horses selected for their willingness to engage. The residents there experience common diets and lifestyles, so that's really good for science because we don't have so many variables. And we have a purpose-built equine paddock with a shaded porch, which is important in Tucson, and a cooled main room where we can do our baseline measures and our post measures. We also have trained facilitators and equine professionals on hand. And in this protocol, so we had 24 people who completed this study. We followed them for 4 weeks, and they had 1 interaction per week for 4 weeks. And this was not, okay, it's called a repetitive measures study design, in that we measured people before, during, and after their interaction for each session. So people are acting as their own controls. We could not have an extra separate control group who did not experience horses, because that would not have been ethical. This is where they lived, people lived, and we couldn't prevent them from interacting with the horses because they live there. So that's the reason. This is a real life situation, and we could not have a separate control group. So we consented the participants. We measured their baseline blood pressure, respiration rate, and heart rate variability while they were sitting in that office adjacent to the paddock. We also measured the baseline heart rate variability of 2 horses. So at any time there were 2 horses that were available for the study. Then we would take the participant outside to the horses. They would be introduced to the research team, and they would all recite a safety agreement, which I will show you in a minute. Then we turn on the heart rate variability monitors on the people and the horses simultaneously. And then the participant is guided with a facilitator to slow down their breathing and do something called mutual choosing. So not only do they choose the horse chooses them. And I'll talk more about that in a minute. And then they do their stroking for 10 minutes. Then we turn off the monitors. We do an exit interview with the participant, which I'll show you soon. And then we take post measures of heart rate variability and blood pressure and respiration.
This is an assisted living community, Hacienda at the River.
This shows you the safety agreement.
Dr. Baldwin works with residents in the equine program in the presence of horses. This is Joe, one of the horses in the program. Before each session, everyone reads out loud the safety agreement.
So that's the safety agreement that they all read together. And you can see that we didn't just have one participant, we had lots of people sitting there because they live there. So this is not just a lab, we can't prevent people from coming. And for a while, this was kind of distracting because they wanted our attention, other people wanted our attention when we were dealing with the participant who was being measured. And so we had an idea We gave them a job to do. We asked them to be silent observers and hold the space for the people who were in the study. And that worked because they felt that they were there and they were doing something useful, which they were. So script for mutual choosing and stroking. So starting the interaction, the resident or participant takes a few deep breaths while sending feelings of love and appreciation towards the horses. And then they approach the horse in greeting with their hand down, and they observe the horse. So this is all guided with a facilitation. They observe the horse to see if the horse is responding to them. So is the horse looking at them, or is the horse stepping towards them? And if the horse isn't, then they wait, and they breathe, they slow down their breathing, go a little bit closer. And there are two horses there, remember, so they're looking at both the horses. And it's usually obvious which horse wants to work that day with that person by their response, by if they're paying that person attention or not. And usually the person who sees the horse paying them attention wants to work with that horse. So that is basically the mutual choosing. And if a horse doesn't want to work, the horse doesn't work. We did have one horse, Joe, actually, who you saw there. We had Joe at the beginning of the study, and he was very good for a while, and then he just got sick of it. He was not showing any interest in interacting with the people, so he was taken out of the study, and another horse was brought in who preferred to engage at that time. So I'm going to give you an example here of a resident's experience with a horse. The lady you'll be seeing, she was 101 at the time of this video. You'll also notice there is a huge traffic noise. Unfortunately, I don't know who designed this, but they decided to put the horses right at the front of the facility on the main road. And there's a lot of traffic noise. But we did get results in spite of this horrible noise that you're going to hear. Sensor on the horse.
All right, so we're going to get started, Virginia. We're going to sit nice and tall, centered, our feet on the ground, from arms to knees, and listening for us in front of us. We're going to start by slowing down.
So this is Virginia in the striped top.
About ready to sit? Okay, pretty soon.
She has to say. So in the exit interviews, we asked 3 questions. What did you sense or feel in your body during interaction? When did you sense it? And do you want to add anything?
And what was the third question?
Do you want to add anything more?
Okay. Virginia, can you tell us what you sensed, if anything?
What I think.
What you sensed. What you sensed with the horses.
What I sensed was
if anything.
I sense that she's actually quite glad to get her. She saw me for a few weeks and didn't have much of an opinion, but she decided that that she'd kind of like to get to know me a little better. So today we began our friendship, and I feel very comfortable that she felt that it went well, and so do I. I don't know if this isn't on well. She's gonna think about it tonight, because I told her I'd see her tomorrow. I'll be over, and I'll be as good as my word, I'll be there. You know, I can opt out if I want, but I don't want to do that. So I'll be over there, we'll meet again and have a nice little chat.
At what point did you sense it?
At what point did I sense it? When she put her head over there so close to me, and I was rubbing her nose, that's when I sensed that she decided that I would be a good friend to have. I hope she hoped that, but I think that's what she thought.
Is there anything else you want to add?
Well, you know, I'd like to keep a friendship going at you. A friendship lies fallow if you don't keep at it. So I'd like to keep at it. And I know myself well enough to know that I have days when I'm too weak to do anything. So I don't want to let that stand in the way of our friendship. I want to prove that I'm there and over for her. And I am.
So you can see how important these interactions are to the people who live there. It really does bring them out. It gives them a chance to form a bond with another being. An animal, also you'll notice that they mention that the people started interacting more with other people as well. So challenges, well, one was limited mobility. You saw an example of limited mobility. So people with walkers, we had to take the walkers out for safety reasons. They couldn't be near the horses. So if a person was using a walker, they were supported with a gait belt and a student. I had a lot of students, a series of students from the University of Arizona who helped with this project. And then if they're in a wheelchair, that was fine. We could use the wheelchair. They could interact with the horse from the wheelchair, but the wheelchair had to be arranged so the horse had an exit if the horse spooked, which didn't happen, fortunately. The weather, if it was too hot, it was not pleasant. If it was too cold, it was not pleasant. So that was a problem we had to deal with. So we had to adjust the timing. Some participants have limited movement of their fingers, and so some of them couldn't stroke the horse like that, so they had to stroke with the back, so we had to adapt. As I mentioned, non-participating residents wanting to interact with the horses too, and we solved that by asking them to be silent observers and holding the space for the other people. Forgetful of appointment time. This was a bad one. So we had to put big notice on their door to remind them, you have an appointment with the horse. We told them a horse appointment is just as important as a doctor's appointment, and that's true. Some of them had irregular heartbeats, and so they could not be in the study because they couldn't give us viable heart rate variability data. Some of them had fragile earlobes, so to measure their heart rate variability, we had two methods. We had a strap that went around their chest with a sensor, and we also had a sensor on the earlobe, so that we had a backup if one of those didn't work. So if they had earlobes that were fragile, then we could rely on the chest strap. Some of them got tired if they had to stand for 5 minutes stroking the horse, and if that was the case, we would put them in a wheelchair, even if they didn't usually use one. And they had all of their measures made before, during, and after while they were sitting in the wheelchair. Oops. Yeah, that's it. Okay, results. So, horses. So, Prissy was the one who chose the most people. This is based on 54 measurements. And you can see heart rate before, during, and after interactions. And her heart rate did not change during the interactions. SDNN is the amplitude of the heart rate variability. Remember, the bigger the better. And you can see her significantly increased when she was interacting with people and then went back down again. So that fitted in with what we saw. She was the one who chose the people the most, and her heart rate variability went up during the interaction. VLF, very low frequency, 66% of her heart rate variability was in the very low frequency, which is normal for a horse. You can see it went up during and then went back down again after. Another sign that she was enjoying the interaction. Herman, this is 28 measures. His heart rate did go up a little bit, 32 to 34. That was significant, but it's quite a small increase. So he was a little bit excited during the interaction. But notice his heart rate variability went up also during the interaction. So that's a good sign. So he was also relaxed and enjoying it, even though he was a little bit excited. His VLF, 66%, just like Prissy, also went up to 71 and down to 68. This was a trend. It wasn't statistically significant, but it was a trend of an increase. So the horses are enjoying it. And we've made many, many measurements on horses doing this kind of work, and we have not found a single horse that is showing like a sharp decrease in heart rate variability, meaning that the whole thing was causing them stress. The horse that was withdrawn from the study, he actually did not show an increase like these two. His remained pretty constant throughout. Humans, heart rate. So remember that we took 4 weeks, 4 sessions, and this is averaged over the 24 people, before, during, and after. And you can see during the interaction, their heart rate significantly increased. That is consistent with them. So an increase in heart rate, it could be that they were excited, which is what they were, or it could be that they were terrified. But we don't think they were terrified because this is data from week 1, and I have to say here that week 1, week 2, week 3, week 4, we did not really see any change long term. I think yesterday there was another study that noticed the same thing with the heart rate variability response. Before and after the session, we see differences, or before and during, but when we didn't see anything long term. You see heart rate went up during and down, as I mentioned. Heart rate variability, this is SDNN, the amplitude of the heart rate, it did not significantly change with the people. So unlike the horses, they stayed pretty constant. But the key thing here is it did not go down. And now, if they had been terrified of the horses, their heart rate would have gone up and the heart rate variability would have significantly plummeted, and we didn't see that. So that's why we are saying that they weren't terrified of the horses, and they did not mention that in the exit interviews either. Their VLF, so starting off at 53, going up to 62, back down to 52. This was a trend, it wasn't statistically significant. So we're seeing a trend here, whereas in our previous studies we've seen statistically significant increase. We think possibly it is because of the traffic noise that we're not seeing statistical differences here. It could be that the traffic noise was preventing some of the people from focusing more on the horse. They were distracted by the traffic going by. In fact, we took 4 of them out to a rural environment, 4 of the same people, repeated the study. 2 of these 4 people had shown an increase in VLF, a significant increase in VLF at the noisy place, and 2 hadn't. When we took them to the rural environment, they all showed a significant increase in the VLF. So that supports our idea that perhaps the noise was distracting some people. Not all the people. Some of the people said, no, the noise doesn't affect us, we're just focusing on the horse. So some people didn't have a problem with it, some people did. Here we're looking at diastolic blood pressure. So diastolic blood pressure is the pressure, the lower number of your blood pressure measurement when the heart is relaxed. And we see a significant increase in diastolic pressure. We're looking at before and after the interaction. So we were interested by that. I don't think this has ever been shown before with horse-related activities. I looked in the literature and I found there was a paper on men who had been smelling grapefruit essential oil, and they showed the same response, increasing diastolic pressure. They also had their cortisol measured, and it went down during the smelling of the grapefruit, so they weren't stressed. And in addition, they had measurements of the activity of the blood vessels that stimulate the arteries that bring blood to the heart. And they also were stimulated. So their diastolic blood pressure went up, the blood vessels bringing blood to the heart were stimulated, but they were not stressed. So this is kind of an interesting response that is very similar to what we're seeing with the horses. So with the increase in diastolic blood pressure, it's a sympathetic stimulation of the blood vessels without stress. So I think that's an interesting response, because by stimulating the blood vessels to the heart, you're bringing the heart more blood, more oxygen, more nutrients, which is really good for people who are elderly. Respiration rate, it went down after the interaction because they were asked to breathe deeper and slower. That drop was only seen in weeks 1 and 2. By weeks 3 and 4, we didn't see that drop, but you might notice that weeks 3 and 4, they're already coming in with a lower breathing rate. Now we're looking at heart rate variability of the horse compared with the human. So the upper panel shows the heart rate variability of the whole interaction. The shaded part is the part we took to measure, which was 1 minute before the end of the activity. And that is spread out at the bottom there. So you can see heart rate is changing in this person. And you can see there's some rhythm going on, different rhythms, different frequencies. And we want to see if the frequencies are the same in the person as in the horse. And there's a mathematical analysis called Fourier transform, which will give you the frequencies that are shown in the heart rate variability. And so the top one is human, the bottom one is horse. This is one example. I want you to look at the VLF, the very low frequency. What frequency spikes in the VLF? Well, if you look at the human at the top, 0.0078, that was the spike we saw in the human. Look at the horse at the bottom, 0.0078. This is 4 decimal places, an exact correspondence of the horse and the human frequency during the interaction. We didn't see, in this case, in the low frequency and the high frequency. You can see they're different there. So, 16 out of 24 residents showed this synchronization of their frequency with the horse's frequency. Several residents synchronized with different horses on different days. It wasn't just their favorite horse, necessarily. And a study's been done by the Institute of Heart Math. They were also looking at synchronization of biological rhythms, including heart rate variability. And they found that they saw this happening, this synchronization between people, like between mother and child, between people working with each other. And they found that when there was this synchronization, there was more trust, more cooperation between the two people showing the synchronization. So it does seem to indicate a bond. And just the synchronization is basically, we think that the horses, we see the horse's heart rate variability frequency, remember, it doesn't just stay in the heart, it goes out in the field. So the field is vibrating, and we think that this field is then training the other field to synchronize. And just to show you what entrainment looks like, I'll show you some metronomes here. So we're starting off at different phases. And now you can see they're starting to move together. So that's entrainment, and you think that's possibly what's happening between the horse and the human. So let's go on to the exit interviews. I haven't got 10 minutes, okay. Exit interviews. So we had students analyze the exit interviews and pick out words that describe sensations and feelings that the people used. And looking at the literature, we were able to categorize the words into positive, neutral, and negative categories. And what we found was that here we're looking at the number of positive words used to describe their feelings and sensations, neutral and negative, week 1, 2, 3, and 4. And you can see in each case, every week, they use significantly more positive words than negative and neutral. So they're describing their experience in mainly positive terms. So it's enjoyable in most cases. And this has got word cloud, so you can pick out the words and see how frequently they're used. And this is just an easy way to show you. The bigger the word, the more frequently it was used. And you can see their favorite words that they used after the interaction: calm, bond, relaxed, peace, energy. Oops. To summarize then, both the horses showed normal, unstressed physiology. Prissy showed a significant favorable response during the interaction. She was the one who chose most people. The humans became enlivened, so their heart rate went up and their diastolic blood pressure went up. So they were stimulated, but it wasn't a stress response because their heart rate variability was maintained and didn't go down. And remember, diastolic blood pressure increasing is good. It was a small increase, and it means it's bringing extra nutrients and blood to the heart. Many of the horse-human pairs showed synchronized heart rate variability frequencies, and I showed you the study that indicates that this is associated with trust, compassion, cooperation, and social behaviors. And the humans became more aware of their body sensations. At first, when we asked them to describe what they felt or sensed in their body, they found it very difficult to answer that question. They weren't used to tuning into their bodies to see how they felt. But by week 3 and 4, they were fine with that. They had learned how to tune into their bodies and tell us how they felt. I thought that was interesting. They became more socially engaged with the horses, but also with our research people, especially the students. The students said that at first they would talk, just very sparsely and just give a one-word answer. But as the time went on, they became more loquacious and more open with describing what they were feeling. So our hypothesis was, we proposed that when older adults mindfully stroke horses, they experience a sense of excitement without stress. We saw that. Along with an opportunity to socially engage with the horse, we saw that too. So our hypotheses were both confirmed. And then, as I mentioned, it's also consistent with this theory that the heart, it's not a theory that the heart produces a field, it's known that the heart produces a field. The theory is that we're seeing entrainment between the person and the horse's heart rate variability fields. So our findings are consistent with the idea that information related to our physiology and emotions is contained in the frequencies of vibration of the heart biofield, and that it can be altered by other people's biofields, or other beings' biofields. So the horse can alter the human biofield. That's our hypothesis, and our results support that hypothesis. So I'd like to thank McCormick Tankersley Charitable Trust for funding this study. We could not have done this study without. I think yesterday we heard that all the problems from NIH not funding this kind of work. It's really, really difficult to get funding for this kind of work. So thank you to Humans and Horses didn't fund us, but thank you for funding the other studies, and thank you to the Charitable Trust for funding this study. And just to finish, I have to plug my book. How many of you know about Reiki? So Reiki is universal life force energy, a Japanese healing modality, which is used on people and horses. Horses they love Reiki. It really makes them relax. Reiki helps reduce pain, reduce anxiety, depression, and increase well-being. And if you want to know more about it, then you can get a discount on my book if you go to Handspring Publishing and use the code RCIRV21. So you can take a picture of that, or you can make a note. And I have a couple of books here if you want to have a look to see what the book's about. So, thank you very much. I think we do have 5 minutes for questions, is that?
That's great.
I have one. Will your talk be available to us, or where can we pick up?
Well, it's being filmed, so.
Yes, and where were you published? Where was the study?
Behavioral sciences. So if you go to behavioral sciences, just Google it and put my name in, you should be able to find it.
Okay, thank you. We're getting ready to, I would like to propose a silver saddle kind of program, and your evidence is would be good support for as I present that to you.
For sure.
Thank you.
For sure.
Oh, that was such a lovely study. I'm just so glad I was here to take it all in. And I wanted to share with you that in our study of riding in the moment, we did videotaped observations as these older adults with dementia were interacting with the horses. And we separated out petting from grooming, from watching them, from riding them, from walking alongside with them. And we used an outcome measure, the Apparent Affect Rating Scale by Powell Lawton, to guide these videotapes. But what really struck me about your study and the convergence there is we found that it was when they were petting the horses that they showed the highest frequency of pleasure.
Wow.
So laughing, smiling, joking, singing songs, hugging, and it's so consistent with what your data is. So I really want to put you in touch with, and put her in touch with you, Dr. Beth Fields at University of Wisconsin-Madison, who's continuing this work, because I think they're just wonderfully convergent.
Oh, that's fascinating. I'm glad that you did the studies to separate out the different activities. That's
Yeah, yeah, yeah. And the one woman was in a wheelchair, and her horse was a donkey named Raymond. And and she wore a lot of lipstick. And by the end of the session with Raymond had lipstick all over his muzzle. It was the most. I still look at those video clips and just get the biggest kick out of them.
I have one question. We only have one experience with an older person as far as dementia in our program, and it was just kind of a fluke person that came through our program. But we, I think, realized the value then of being on the ground with the horse. And I think before that, I just thought you got to be on the horse, you know, the whole riding the motion. And I think we kind of appreciated the value of that in that one experience. But if you get to a situation where the person in the state of dementia does not want to do it, do you just drop it? I mean, we ended up with, by the end of our time with her, she really did not want to be separated from her husband to be with us.
Yes, people do change, that's true. We did have one woman, she just loved to be with the horses. And she was in our study, and she kept going to the horses when our study was finished. But she reached a point where she couldn't do it anymore. So there are limitations, that is true.
So you just kind of, at that point, you
can't force people to do it.
I just was so struck by that exit interview that somebody 101 years old could be so forward thinking that I'm going to show up tomorrow, I'm going to keep it. I mean, that in itself is an incredible thing to pursue with this sort of work, you know, to have these opportunities.
Yeah, that's what I mean about the horses, drawing them out. They give them a reason to come out and interact with everyone in the world, yeah.
And she was self-regulating in that she realized apathy or lack of energy was normally would hold her back,
Yes.
but she was going to overcome that.
Yeah, she has motivation.
Yes.
Just a quick question about your exclusion criteria with the arrhythmia. I was just wondering how you decided that, and were there other things that you had to exclude? Because I've been doing a study comparing equine and canine and to a regular like rec therapy activity. And one of the things that we brought before the pandemic people from nursing homes to our facility. And one of the problems is that we don't really have access to their medical records.
Oh, yeah. So what we did was, before we consented them, so we got people who were interested, and then they would come for a little meeting with us, and I would bring a heart rate variability monitor, just one that was quick and easy, that could show if they were, in 5 minutes, if they were showing any arrhythmia. And if they were, then we could not consent them.
And agreed, and I did the same thing, but what I was wondering is, were there any other things that you excluded, other than arrhythmia?
Let me think.
Like congestive heart failure?
What was that?
Somebody who has congestive heart failure or other.
Oh,
heart
right,
disease.
yeah. Because usually if they've got congestive heart failure, it shows up in, you'll see it in the HRV. So the main thing was HRV. We didn't really have many exclusion criteria because we wanted to just test, these are the people that we have, and we can't exclude them all. You know, we can't say, oh, you can't come because you're taking medication for high blood pressure. No, everyone could come unless they could not provide us with a good heart rate variability reading.
That makes sense, because then you'd be excluding a lot of people.
Okay, well maybe we should.
Thank you.